Hello and welcome to ExtrapoLife, a podcast where we discuss the digital transformation of healthcare, mainly through artificial intelligence, and extrapolate current applications to see what the future holds for life sciences. You're listening to the first episode, and my name is Oliver Wellich, and I'll be your host from Cognexa. In front of me is our guest, Dr. Štefan Korec.
Hello, good morning.
Welcome to ExtrapoLife, Doctor.
Thank you.
Thank you for coming.
Thank you for having me here.
Dr. Korec, let me introduce you briefly to our audience, even though I think that you already may be very well known for anyone listening to us, but just a quick recap. Dr. Štefan Korec has more than 50 years of experience in clinical oncology from both Slovakia and the United States. In the early 70s, he was a pioneer of applying cancer immunotherapy into clinical practice in Czechoslovakia. He then followed to research cancer immunology at the National Cancer Institute in Bethesda, Maryland. He extended his medical qualifications at Georgetown University in Washington, D.C., where he also continued to teach young medics and doctors. He returned to Slovakia after Velvet Revolution and founded the National Cancer Center of Slovakia in Bratislava. And with breaks, he led the center for 10 years. After this experience, he moved back to the United States and founded a cancer center in Alamogordo, New Mexico. After 15 years in the States, he returned back to Slovakia. He founded a web, OncoInfo, that provides easy access to relevant information for oncological patients, and now leads a project of the National Cancer Center aimed to leverage digital transformation and artificial intelligence in oncological patient management. I hope everything was correct.
Yeah, a little change there.
Mm-hmm.
It is a joint project between the Alliance, Oncology Alliance of Slovakia,
Mm-hmm.
National Cancer Center, and Ministry of Health. So it's actually three different institutions working closely together.
Mm-hmm. Okay, thank you for the correction.
But thank you.
Okay. In this episode, we'll be talking about a general perception of artificial intelligence by physicians in the world and in Slovakia, the transferability of digitalization and AI innovations between countries, and future challenges for artificial intelligence in oncological patient care. Dr. Korec, welcome again and good morning.
Again, thank you.
Deeply honored to welcome you as the first guest in our Cognexa podcast. And I would like to start just lightly. What was your holiday like, summer holidays?
Well, A was COVID restricted. Mm-hmm. B, we were preparing the project, what you just mentioned. We worked hard and in close collaboration with physicians, general practitioners, specialists, and National Cancer Center to prepare the application for support with European funds, with EU funds. So I spent my summer mostly here in Slovakia working on this project.
Okay. I hope that you will find time to relax and have a holiday, maybe later in a year.
The time will come.
Thank you. And you just came from television. Just before this interview, you were invited to private broadcaster here in Slovakia. And can you tell us what were you talking about there?
The main topic was prevention, cancer prevention, and the very sad situation in cancer care and cancer mortality, that Slovakia is number one in cancer incidence in mortality in European Union. Not only being number one, but per every 100,000 people, there is 100 more cancer patients are dying than is average in the European Union. So we are that far ahead of other countries. So the topic was, yes, situation is bad. What can we do for prevention, early detection, and how can we in general improve patient care, but mostly prevention and early detection.
Mm-hmm. Thank you. Maybe we'll touch on that briefly in this podcast as well. Thank you. And after these brief introductory questions, I would like to move to more professional questions from your field. And we will be talking a lot about digital transformation and artificial intelligence. And probably our audience is already don't know well what these terms mean, but just to have a quick reminder, digital transformation is usually defined as the adoption of digital technology to improve processes, to bring new value for patients, and to accelerate innovation, so specifically for healthcare.
Absolutely agree.
Yeah, and what, in your perspective, is the main goal of digital transformation in your project in oncological or cancer patient care?
Your definition is very correct. We just like to add artificial intelligence to this description of digitalization. At present time, in Slovakia, the time from first signs, first symptoms of cancer, when the patient first time present to his general practitioner, to the initiation of treatment is extremely long, and it's not acceptable. For instance, for patients with lung cancer, the time is roughly 160 to 180 days. 180 days from the very first presentation to initiation of therapy, which means the patient may have come with the early stage, but 180 days is 6 months. Mm-hmm. Within 6 months, the tumor may have progressed to the point that it cannot be operated on, which is very significant. Our goal is to implement digitalization softwares, to implement artificial intelligence at every level wherever it's possible. So we'd like to shorten the diagnostic time from the 180 days. We'd like to go down to 50 days, which means we will be getting closer to the situation in civilized countries.
Okay. So is this 50 days benchmark, or the 50 days goal, benchmarked by your experience in the United States, or is the situation there still different?
No, I think in the United States, when we have a close contact, good communication between general practitioner, specialists, pathologists, oncologists, and a surgeon, the time from the first symptoms to diagnosis is closer to 30, 40 days. We are still longer than in the United States, but yes, its significant improvement is roughly 1/3 of the time what we see now.
Yeah. Okay, thank you. And also the term of artificial intelligence, maybe there are some discrepancies between how programmers and how doctors see what is artificial intelligence. So just a broad definition could be it's a computer program, or it's a broad spectrum of computer science that specifies in creating computer programs that are capable of learning patterns from data. And with that, probably predicting future or finding patterns that would not be accessible by human expert. And sometimes to get this through to physicians or to practitioners, there's good to have an analogy. So do you have any favorite analogy how you can explain to anyone not interested in computer science what the artificial intelligence is and how it could help you?
It's not an easy question. I think it's like when you are a good physician who should be able to say, I don't know, but I know where to find it. That you have to look at 2-3 books, go through 5 different papers till you come up with the right solution. However, this work, this whole time can be saved by artificial intelligence, which learns exactly the patterns, learns the data, and comes up with the recommendation, not direction, but a recommendation for further steps, which means saves time, is more precise, and hopefully will reduce the errors, medical errors, which means it's more precise, faster, and gives you broader spectrum.
Mm-hmm. So this analogy is for me is close to what we call a virtual assistant or virtual colleague that would guide you or help you, or if you had a supervisor but not a supervisor, just a colleague that would guide you. I also like to compare the AI or use a real world application of AI in autonomous cars, because the first is that a lot of us have experienced what it means to drive a car and what challenges it poses. And also in the media, there's a lot of coverage on the progress of artificial intelligence, so people can see how it progresses from a few years ago to now, where the first applications are in the real world. But this might, and also the third thing is that there is already a scale of autonomous driving, so we can say at which stage we let computers take control from us. But as you mentioned, that having the virtual colleague may be still better connected to the physicians than something from automotive world. And do you or maybe what is your personal perception of start again. What is your personal perspective on the usage of artificial intelligence in the current medical care? Do you think it has place already and it should be used, or it's still immature and we should develop it more, or it will not have such an impact in the future and will always be assisted by a human expert?
There are several questions in this question. Is very loaded question. Mm-hmm. Depends on where we are practicing medicine. There are countries, there are institutions in Netherlands, in United States, where artificial intelligence is already broadly applied and used in several, not only top institutions, but also at the level of general practitioners, where it is used to speed up diagnosis, to be more precise, and where it is clearly showing that it's reducing the medical errors. If you'd like to, I can start from the very beginning. Let's see. Interpretation of mammography. Mm-hmm. While the digitalized mammography imaging made a major improvement for physician interpretation using the digital mammography data, using artificial intelligence, is not only equal to physicians, but it's less prone to less mistakes, and right now is already being used as a second reader or in the clear-cut situation as a first reader only. But right now, as a second reader, it's a great already corrector of physician's mistake. Same, for instance, reading chest x-rays, reading chest CT, CAT scan of the chest, looking for pulmonary nodules, which are suspicious. Not only can artificial intelligence equally or better than physician identify those pulmonary nodules, but it also can say, yes, this one is highly suspicious, this is not suspicious. Mm-hmm. I was just talking about radiology. Yep. You want me to talk more, or you want to put questions?
Sure, continue.
Okay. Next is the digitalized pathology. Today's pathologists already moved from microscope, where he looked at part of the slide, to whole slide imaging. Means when he moved this slide on the glass underneath the microscope, he only looks at certain part. When the slide is digitalized, he can see the whole slide on the screen. Plus the artificial intelligence has is prone to making less mistakes than physicians. While when you take 100 pathologies, their discrepancy is at the level of 5%. Artificial intelligence reading good programs, of course, artificial intelligence is down to less than 1%, means more precise diagnosis, which means that we'll be treating the real disease and not treating something which is not there. So this is radiology, pathology. Next, what we are talking about is today's medicine is based on genomics. Interpretation of genomic analysis, it's far beyond human capability. So artificial intelligence not only interprets the findings, but can also put it together. This is the genomic finding. These are the genes which are affected. This is the patient's clinical pictures. These are his CTs. This is the stage of the disease. These are the findings of the genomic analysis, putting it together, and will suggest to the physician, yes, this is the optimal treatment. This is not fantasy. There are institutions which are using it. There are already softwares that are available to the physicians. Next, where the artificial intelligence is probably ahead of the physicians, that we can evaluate the patient based on his clinical findings or CT findings plus pathology, and say this patient's probability to survive 3 months is high or low, which is extremely important, how to treat the patient, how to classify the patients, and for the patient is extremely important information how to deal with his disease. I just mentioned about 4 or 5 areas. I could go much further.
Sure.
But yes, as you see, I am a major fan of artificial intelligence. The second part of the question was how much is being used and how is accepted. Now we again have to talk about Slovakia and about the civilized world. I use it at Slovakia and civilized world. There is a difference. In the countries which are well developed, it's widely accepted already. It's a given. It's a given that yes, artificial intelligence and digitalization is here. I'm oncologist. I only can speak about oncology. Oncology is one of the main areas where artificial intelligence and digitalization can be applied because it's algorithm driven. If A and B is true, then you can expect the result will be C. And medicine as such, of course, it's a broad area, which is, again, not only oncology based on algorithms. Therefore, this is the area where artificial intelligence should be applied. Unfortunately, we have to also not only geographically divide physicians, but also by age. Young physicians who are digitally literate, digitally educated, are accepting it. Elderly physicians or people probably older than me, I can speak for them because I am the gray-haired bald man, are afraid. I've been studying it for 20 years, suddenly machine is going to replace me. No way. Machine, I have studied it for 30 years. No way. So they are afraid that it will be replaced. The mantra is, can artificial intelligence replace a physician? The answer is yes, and it should replace a physician that is replaceable by artificial intelligence. If a physician can be replaced by artificial intelligence, he should be replaced, because a high-quality physician is welcoming an assistant. This is help to him. Like when you have a smartphone in your hand, you welcome the smartphone and it will give you much broader spectrum of communication and information. However, people who are not able to use smartphone are afraid of the smartphone and don't want to use it. Sorry, I've been talking too long. Go ahead.
No, it's okay. Thank you. Thank you for a great perspectives. And so if I summarize it correctly, you are positive, or you have a positive perception of current AI applications and optimistic about the future of AI in medical care. And is it
I'm
okay?
not only optimistic, it's here. It's here. It's good institutions are using it already. It will speed up the diagnostic process, what I mentioned. It will reduce the cost. It will reduce physicians' time spent by looking through the documents and data. It will make a physician, and this is a paradox, that artificial intelligence and machines will make physicians more humane. Why? Because today, when patient walks into the exam room, physician sits by the computer and just, by the way, talks to the patient. When all of this work is done by the machine, physician can turn to the patient and go deeper relationship with him. And this is the real physician now. So again, it's a paradox. More machine makes physician more humane. And that's the goal. Not only faster, not only cheaper, not only more precise, but finally, we will be able to offer the quality of medicine what the patient deserves.
Thank you for this perspective. Let me just add a quick personal note to this, because this future where physicians are more humane and more caring for the patient that they have there is like beautiful for me, because I think a lot of people here have experience with a physician that is, as you said, looking mainly at the monitor, not at me, and just speaking in language that I mainly don't understand, and quickly just trying to get rid of me. And so, a quick
Let's not talk generally. There are physicians who
sure.
take extra time who are very good, but yes, many times a physician, just to defend the physicians, knows there are 20 people sitting in front of his door.
Sure, definitely. So a quick note from me, personal. And when our first child was about to be born, and we wanted to know the gender, and when we were at the examination, the physician there was just going through all the parameters, all the details, and then it was looking at the monitor and going through. Okay, do you want to know the gender? And yes, we do want to know. Okay, it's a girl. Let's continue. Blah blah blah. Okay, so it's really crashed.
By the time we started understanding, you were already out of the office.
Yeah, sure. So just getting back to what we were talking about, and it was the general perception of artificial intelligence. Your positivity and optimism, let's say it like that, generally lies within what is publicly what is the public perception of AI based on studies. I have a few here in front of me. One is from China, where they studied posts on their social media to see what is the perception of public, and they found that at around 60% were positive about using AI in medical care, and only 6.2% were negative, when the main concern was that it is immature yet to be used. And from the United States, there was a survey of radiologists, actually, and in this survey they ask about what if they use artificial intelligence in their clinical practice, and from 2,000 responses they received that 23% of American radiologists already use artificial intelligence in clinical practice, and about 70% do not use any, and others are in development. And when they ask what they think about the usage of the AI when they are using it, the general perception was that or the answer to the question, how often is it clinically accurate, only 5% answered always, and 93% sorry, and 93% answered that it's inconsistent. Do you maybe have this this experience as well, that when you looked at the results that it produced, you mentioned that it made clinical parameters better, but sometimes it's problematic when it's not generalized to be used at different clinics. So at one clinic it works perfectly, it makes clinical parameter better, but at other clinics it does not even match a human expert, and it's worse. Do you remember any application that you've come across this inconsistency?
From my practice, no. I am theoretician. I read about it. I know about it. I discussed it with the radiologists. And yes, it depends on the radiologist. It's not just the violin. It's the violinist as well. On the other hand, if you have Microsoft Word or Microsoft software, Apple software, on your computer or everybody else's computer, Microsoft works the same way, I think. I think if the artificial intelligence, if the software with artificial intelligence is well applied, if it has good machine, well applied, well administered, the computer can do just what you taught him, what he knows, left or right, cannot go different other ways. So I am a believer that yes, it is better. I just give you the own discussion or experience with a very smart radiologist in the U.S. who claimed that he is one of the best CT readers and one of the best MRI reader. And I said, fine, machine will come and will replace you. And he says, yes, machine will and should replace the below average and average physicians. They should, but not me. Which means the good physicians are welcoming it. And he said, yes, I'm reading 60, 70 CAT scans a day. I'll be reading 600 when I use the machine. Means I am already training my machine. I trust my machine. And if my machine says no, it's no. If it says yes, it's yes. And the in-between, when machine will say high probability, that's when I enter, and that's when I correct the machine. But in general, we have yes, no, clear, and we have two readers on the foggy area, Therefore, I'll be increasing quantity, improving quality. Yes, this is physician who is already using it, who is training his own machine.
Yeah. And you've come right across to the point where also the survey comes, where they ask if AI is currently safe to run autonomously. 5% of radiologists said yes, 95% said no. But this is not the bug of the system, this is the feature. Because the future of AI is in the cooperation of the physician and the AI, and only with that we can achieve the goals of
absolutely.
Care. And okay, so you've mentioned that there are a lot of already cleared applications of artificial intelligence. Just to have some numbers, in 2020 it was 111 AI FDA cleared AI applications in radiology only, and it was twice the amount as it was the previous year. So we can expect that this would continue with exponential growth. And so this suggests that at least in radiology and digital pathology that you've mentioned, these two areas are already mature and well prepared for AI implementations in the industrialized world. Or, as you mentioned, do you think this notion is valid worldwide or only valid for Slovakia? Or simpler question, is this notion valid for Slovakia as well?
It's coming. The physicians, young physicians I'm talking to, and we are discussing usage. Yes, they welcome it and they are accepting it. And again, there are physicians, and I was told by the summer or springtime by physicians whom I respected past time, who told me, Slovakia, no, not now. Wait 5 years, wait 10 years, not yet, not now. We are not ready. And this is the peril of Slovakia, that we think, no, we are not ready. Wait, well, till everybody choose it, everybody digest it, maybe then. No, we need to start to put us to get to the starting line where everybody else is, not wait 10 years till somebody else produces it, and then we can say, yes, it's good for Slovakia. As you see, I am a Slovak. I was repeatedly talking about Slovakia being a little bit behind the other countries, but yes, I'm a proud Slovak and not a nationalist, and I claim, yes, Slovakia can do it as well, especially when we use these young people. No, in general knowledge is not accepted yet in general physician population.
So do you think the key ingredient to implement these digital transformation or the digital applications to medical care is the physician's perception or the physician's attitudes towards AI? Or, for example, if I want to move from Slovakia to worldwide, because artificial intelligence is a lot of times linked with providing care where it's not possible to do it with human experts, because there's a lack of experts and a lack of medical devices that are expensive. So do you think that it's possible to transfer these AI applications also worldwide to poorer countries? And what are the key factors for that?
Absolutely, yes, you're right. Absolutely. One machine run, let's see, CT machine, run and results read by one physician versus machine run by one physician with the help of AI, which I just mentioned the example of the friend of mine who said, I'll be reading 10 times as many scans, will save physicians time, will provide the services to the areas where we cannot guarantee physicians, with the use of fast-speed internet, with the use of telemedicine, with the use of artificial intelligence. Suddenly we can provide high quality of medical care at the level of top cancer center to the very rural areas. Yes, that's where I see the future. Not everybody could or should travel to tertiary cancer center, only those complicated cases. But the basic oncology is turning completely outpatient, not hospitalized. B, we are switching to oral medication. C, we are more and more dependent on high technology, with artificial intelligence will help, with digitalization. That's the future, and that's the future that's already here. Nobody can say, well, in the future. It's starting. We may fall behind, but it is starting.
Great, thank you. And it's great to talk about what lies ahead in the future. And it seems like the future 5 years in the US will be different than future 5 years in Slovakia and future 5 years in Africa or rural areas. But I'd like to talk a little about Cognexa and why we are doing this podcast, why we are talking about the future.
Please do. I'm very interested in hearing about it.
Thank you. Cognexa was founded 5 years ago as a technology provider specializing in the field of artificial intelligence. Through many projects for various customers, ranging from startups through clinics to large corporations in different industries, we in Cognexa realized that the way to bring revolutionary innovation that would affect human well-being the most is to partner with pioneers from healthcare practice and bring our own innovative solutions for life sciences, to create the solutions with the partners. And we are on our path to define the products for the future. So that's why we want to talk about the future and what lies ahead. And I would like to ask you about the AI implementations that you've mentioned. You've mentioned a lot of them. Is there any one that you could pick that you encountered and impressed you the most?
If I encountered what?
An artificial intelligence implementation that impressed you the most, and to reframe the question, that you would like to bring to Slovakia?
It's a whole lot. Not everything is transferable. It's a question of money, question of support by companies like you. I personally believe, and when you mentioned transfer, bring to Slovakia, I believe that the rounded wheels have been already discovered and well developed, that the wheels discovered in Slovakia will not be rounder than the wheels we are using right now. We cannot reinvent them. I believe that we have to select and start building our own on products which are already far advanced, so we can learn from their mistakes. So we don't have to spend our money on products that are leading nowhere. So Slovakia should be importing as much as possible, but not blindly importing, not being just a production assembly line, like we are assembling some cars or whatever, but being here co-developer, and I stress co-developer, but not homegrown in the valleys of high Tatras. They are beautiful, but they are far from the reality, thanks God. They are hopefully protected and will be protected. But here we need to open up, and we need to communicate and select and pick. I have problems right now, go through all the companies which are and which are not progressive, which are to be used, not to be used. Where can we learn and who can we learn from? As you mentioned, the hundreds of softwares, of AI softwares applicable in medical field. Again, I think we need now artificial intelligence to go through artificial intelligence softwares and select for us and help. And therefore, I'm very interested in hearing what is Cognexa right now doing and where you are.
So you've mentioned that you are working on a project for cancer patient management. Can you talk a little bit more about it and what AI could do or help with this project?
Fine. As you see, this is a flow of patient flow from diagnosis, from first symptoms to therapy to personalized therapy. It starts with primary care provider, PP, primary physicians, who has this is missing here, who before even he sees the patient fills out the form, electronic form, with his symptoms, waiting in the waiting room or back home before he even enters physician's room. By the time he enters the physician's room, it is on physician's screen is already the whole anamnestic information about the patient. The primary physician adds his own findings between the form that patient filled out, the physician's findings. When they put it together, there will be certain red lights which lights up. If patient had in his form diagnosis this or this information, or you found this and this on the physical exam, pink red light goes. Don't send him to rehab. Send him directly to specialists. This will save us time. Physician has his medical record from the patient visit. what is very important, clicks in one click. They insist on one click, where he clicks gastroenterologist or pulmonologist, wherever he's sending the patient, and goes. Within the one click, the computer selects the physician specialist who is supposed, whose area is this, a referral area, or physician who is available sooner and doesn't have such a long waiting time. When specialist receives from the primary physician the report and request for evaluation, with this one click it goes in the form of request. Please evaluate my patient. He gets all the information what the primary physician found why he's sending the patient to specialist. What the specialists are complaining about is, I receive a patient, please evaluate. For what? No mention. So he will see the whole medical report from the very first encounter. It gets to specialist. Specialist does his job, either performs biopsy or performs specific tests, puts his report again into the universal communication system. And the primary physician knows right away what's going on. Primary physicians are complaining. Even if I send to specialists, patient comes to my office 2 weeks later, I don't know what's going on with him. So he will see. When he orders imaging studies, CTs, MRI, that's where artificial intelligence comes in. Artificial intelligence assisted interpretation will speed up the whole process, and as we discussed, hopefully reduce the medical errors, human error. Orders biopsy, and again, biopsy should be, again, artificial intelligence assisted, which means not only, yes, there is a nodule. There is a nodule in the lungs and it is peripherally, therefore go through the chest wall, don't go through bronchoscopy. Comes to pathologist. We were discussing pathology interpretation. Does a genomic analysis, morphological analysis, those two get together. Again, artificial intelligence will summarize it and offer the physicians the best treatment available. What we think is also very important in this, that there are two factors. One, the red lines are the guidelines or recommendation. It's not what you have to do, but what is the best treatment available at every step of the primary physician, gastroenterologist, everybody, they will see it all the time. Two, the dotted line, the blue dotted line, is patient information. As you mentioned, you walked out, you didn't know what's going on. From patient will have at every step, whatever is going on, he will see, yes, I'm here, and according to the guidelines, my next step should be this. I'm here, according to the guideline, my next step should be this. For instance, don't do chest X-ray, don't do ultrasound. I need CT right now. Don't give me just pills. I should be evaluated. This is because for you as a patient, you get 100% attention. For the physician, you're one of 10, one of 20 patients, so you have 20% attention, 5% attention. So this is the dream. We were already discussing this project with primary physician. We had discussion with specialists. We had discussion with pathologists, and we have oncologists ready to participate. So we have the components of the various components of the project. Now we need to just make a nice necklace out of it and serve it. So this is the dream.
Great. Thank you for the introduction to the project.
Thank you.
And we see, we can leave it there. We see that there's a lot of places where artificial intelligence can assist doctors to interpret the patient history, the patient data, and patient current state from imaging and from pathology. And is there a part of the whole patient care that is not usually thought as suited for AI, as not these parts, but do you see a potential for a virtual assistant? My ideas were, for example, if a mental health assistant for oncology patient would be something that would help in the patient care, or for example, something that would help with the medication adherence, or just a general virtual assistant in mobile phone of an oncology patient.
Absolutely, yes. Absolutely, because a cancer patient is not just patient for one visit. He lives with his disease. He thinks about the disease. It's a life-threatening disease. So it would be great benefit for him to have it on mobile phone, to recheck again what's going on, to recheck the availability. He cannot do it in the physician's office all the time. So he has time at home discussing it. Most of the patients are trying to discuss the treatment and diagnostic options with other physicians, second opinion, or with the lady who collects, I don't know what kind of herbs, but they discuss it, and in order to be correct in their discussion, they need to have the starting points, recommendation points, and then they can do the correction. Yes, it would be major help.
Mm-hmm.
And it would be major help for the physicians. I just yesterday discussed with a group here in Slovakia who are preparing small software where they measure blood pressure, measure blood sugar at home, and if there is any problem, it directly sends it to the physician. So patient is at home or in his nursing home, and so yes, it will be. It's kind of telemedicine combined with artificial intelligence.
Mm-hmm. My idea was that the first step of this whole process is to provide relevant information to the patient, which was the OncoInfo web portal. So this their virtual assistant is in the personalization, that they can get their personalized information and what is relevant for them, and what recommendations are relevant for them. Okay, and these are all the questions that we have prepared for this discussion. Thank you very much for being here. Thank you very much for providing your perspectives on AI and your positivity towards the AI. I'm really glad that, as you mentioned, even in Slovakia, we have pioneers like you that believe that this is the way forward, and it's the way it is here, and it's inevitable to get used to it.
I thank you very much. I've learned again something in this kind of discussion. I know I've been talking to somebody who is deeply involved, so I have learned, and it's an honor for me to be your guest in your first podcast. So yes, I appreciate and thank you for having me here.
Okay, thank you. I hope we will be able to welcome you again, maybe sometime in the future, and have a nice rest of the day.
Well, we'll have the future of medicine right here. Thank you.
Thank you.